Hello, and welcome to Health Insurance, a guide to important terms to know. I'm Josh with Community Health Plan of Washington, and I'm glad you're here. Health insurance can sometimes feel overwhelming, especially with all the unfamiliar words and phrases. But understanding a few key terms can make it much easier to choose a plan, use your benefits, and avoid unexpected costs. In this video, we'll break down some of the common health insurance terms like premiums, deductibles, copays, coinsurance, out-of-pocket maximums, and provider networks in simple to easy to understand language. Whether you're enrolling in health insurance for the first time or just looking for a refresher, this guide will help you feel more confident about your coverage and how it works. So let's start with providers. A provider is someone or someplace that delivers healthcare services. First, a healthcare professional is someone who treats you. This could be a doctor, a nurse, practitioner, therapist, or any other licensed health professional. Second, a healthcare facility. This is where you receive care. Examples include clinics, hospitals, urgent care centers, and specialty offices. Lastly, online care allows you to connect with a provider remotely through video visits or telehealth services. All three are different ways that people receive healthcare services to meet their healthcare needs. One of the most important providers you'll have is your primary care provider, often called a PCP. A PCP is your main healthcare provider that helps manage your overall health. They'll provide routine checkups, preventative care, vaccinations, treatment for common illnesses, and answer any general questions about your health. Think of your PCP as a starting point for your healthcare journey. If you need specialized care, your PCP can help connect you with the appropriate specialist. At CHPW, members are enrolled with a primary care provider right away. You can choose your own PCP, or you can be assigned one if you don't know where to start or you're unsure who to select. Now let's talk about provider networks. A provider network is a group of doctors, hospitals, and healthcare professionals that have agreed to work with the health insurance company at negotiated rates. An easy way to think of this is like a streaming service subscription. When you subscribe to streaming services, certain movies and shows are included with your membership. Those are similar to in-network providers. If you want to access something outside of your subscription, you may have to pay extra or it's not covered at all. In health insurance, providers outside of the network often cost more or are not covered at all. Most health plans provide a directory or online search tool so that you can find providers that are in your network. So before we move on, it's important to mention Apple Health, Washington State's Medicaid program. Apple Health provides health coverage for individuals and families based on other income and eligibility requirements. Many of the cost-sharing expenses we'll discuss today, such as deductibles, copays, coinsurance, premiums, and out-of-pocket max, work differently or may not apply at all for Apple Health members. We'll point out those differences as we continue through the presentation. One of the most important costs you'll encounter with health insurance is a premium. A premium is the amount you pay each month to maintain your health insurance coverage. You can think of it as a subscription or a membership fee. The premium is due every month and typically stays the same throughout the year. It's important to remember that you must continue paying your premium to keep your coverage active, even if you don't use your healthcare services during the month. Also, premiums do not count toward your deductible or your out-of-pocket maximum. Another important term is deductible. A deductible is the amount you must pay for your covered healthcare services before your health plan begins sharing costs with you for certain services. For example, if your deductible is $2,000, you generally pay for the first $2,000 of covered services yourself before the plan starts contributing toward those services. Some services are considered pre-deductible. This means your health plan helps pay for them right away, before you even met your deductible. A common example is with Community Health Plan of Washington, Cascade Select, and individual plans. They help cover the costs for preventative care and annual checkups. After you've met your deductible, you may begin paying copays or coinsurance while the health plan pays its share. It's important to note that if you qualify for Apple Health, there are generally no deductibles to meet. People often confuse premiums and deductibles, so let's compare them. Your premium is what you pay every month simply to have health insurance coverage. Your deductible is what you may have to pay for covered services before your plan begins sharing costs. Generally speaking, plans with lower monthly premiums tend to have higher deductibles. while plans with higher premiums often have lower deductibles and lower the costs when you receive care. When choosing a plan, it's important to think about both your monthly budget and your expected healthcare needs. Now let's talk about copays. A copay is a fixed amount you pay for a covered health service. For example, your plan may require a $20 copay for a doctor's visit. No matter what the visit costs, your share remains the same fixed amount. Copays provide predictable costs, making it easier to budget for care. Depending on your plan, copays may apply only after you've met your deductible, unless the service is covered before the deductible. For Apple Health members, copays are generally zero. Coinsurance is another way health plans share costs with members. Instead of paying a fixed amount, you pay a percentage of the covered service. For example, if your coinsurance is 20%, you pay 20% of the costs, and the health plan pays the remaining 80%. Unlike copays, the amount you pay may vary depending on the cost of the service, and coinsurance is often billed after you receive care. Let's compare copays and coinsurance. A copay is a fixed dollar amount, while coinsurance is a percentage of the actual cost of the service. Both are forms of cost sharing and help determine how costs are divided between you and your health plan. For example, your health service is $300. Your copay or your fixed amount is $20. Coinsurance, your health service costs $300. Your coinsurance is 20%, you pay $60. Different services within the same plan can have different cost sharing requirements. You can find this information in your health plan documents before you receive care. So what are out-of-pocket costs? Out-of-pocket costs are the expenses you pay directly for covered healthcare services or your responsibility. These costs include the amounts paid towards your deductible, copays, and coinsurance. Together, these are often referred to as cost sharing. It's important to remember that monthly premiums are not considered out-of-pocket costs and are tracked separately. So one of the most important protections in health insurance is the out-of-pocket maximum, sometimes called the MOOP, which stands for max out-of-pocket. This is the most you'll pay for covered in-network healthcare services during a plan year. Once you've reached this limit through your deductible, copays, coinsurance, your health plan pays 100% of covered in-network services for the rest of the year. For example, if your out-of-pocket maximum is $7,000 and your deductible is $600, once you've paid a total of $7,000 in eligible cost-sharing expenses, your plan will cover the rest of your covered in-network costs for the remaining plan year at 100%. This protection can be especially valuable during years when you have major medical expenses such as surgery, childbirth, or ongoing treatment. Remember, these premiums do not count toward your out-of-pocket maximum. So when choosing a health insurance plan, understanding health insurance terms can help people choose a plan that both fits their healthcare needs and their budget. I want to thank you for taking time today, and I hope this overview has made health insurance terminology easier to understand and has given you the tools to make informed health coverage decisions.